Good morning, good afternoon, almost. We're right between the two. I'm Susan Santa Cruz, and I am the moderator for this session on the next to the last day of the Six Bridges Book Festival. It's been a wonderful festival. I've seen all sorts of great things. But today's presentation should be very, very interesting and enjoyable. Even though it may be a subject that people think of as a difficult subject, it's going to be touching and honest. And I, as a former hospice physician, have great interest in this subject. And as an artist too, this was a wonderful combination for me to get a chance to be the moderator for. So I'm going to go ahead and introduce Jennifer O'Brien, and she will be presenting her book, The Hospice Doctor's Widow. Jennifer was born in Chicago and raised in Santa Fe, New Mexico. She received a BA in literature from Boston University and a master's degree in organizational development from Loyola University in Chicago. She's been an educator and consultant for over 30 years and has held an enormous variety of positions such as business manager, director of leadership development programs, manager of operations strategy, and senior organizational development consultant at LSU Healthcare Network, Tenet Healthcare Corporation, and Chicago's Rush University Medical Center. She moved to Arkansas in 2009, working as the executive director of Arkansas Specialty Orthopedics, and later practiced executive at the Little Rock Diagnostic Clinic. And during that time, she still had a very busy consulting practice. This introduction is somewhat different in that I'm also going to introduce her husband, Bob Lemberg. And Dr. Bob Lemberg received his medical degree from the University of Texas Medical Branch in Galveston. He was trained as a plastic surgeon at Baylor College of Medicine in Houston. He had a very active, busy practice in Little Rock, primarily doing reconstructive surgery such as trauma, burns, congenital anomalies, hand surgery, breast reconstruction following mastectomy, and microsurgery. And he was my friend. After a neck injury prevented him from operating, he retrained in hospice and palliative medicine. He completed his fellowship at the Central Arkansas VA Health System and UAMS and joined the faculty as an assistant professor. Then Bob was diagnosed with stage 4 metastatic cancer, and their world changed. And now I'm going to introduce again to you Jennifer O'Brien.
Thanks so much, Susan. I can't tell you how special it is that, that you and I are doing this together. Okay, I'm sharing my screen. And my computer is acting really a little bit strange. So you're seeing that, Susan? You're seeing my screen?
Here I am. Mm-hmm.
Great. So yes, thanks so much for that introduction. And I thought that we'll take it from that point where Bob was diagnosed and start with the fact that the book was really kind of never meant to be a book. I am a self-taught collage and assemblage artist, and right about the time that Bob got diagnosed, I was teaching myself digital collage and started to keep a journal about our journey through his diagnosis using digital collage, which if you've ever tried to teach yourself how to do go from doing something manually to doing something using a computer program. Well, let's just say it was the perfect balance of head and heart on this particular project. I get asked a lot about the art in the book, so I thought we would start with that. And There we go. I thought we'd start with a digital collage that is not in the book. I did it right as the pandemic started and the shutdown started. And this is the final collage, and I'll take you through how I do it. But the subject matter here is that one of the things I was really hopeful about with the pandemic and the shutdown was that people would get an understanding of what caregivers already know. And that is that fear and anxiety and foreboding, confinement can easily become an intimacy, a patience, a courage, a love that you just never knew you were capable of. That's what happened when I took care of Bob. And I think that's somewhat what's happening. I hope that's what's happening in our world now for everybody else. Anyway, so this is what the final collage looks like. This is the first layer. It's just some illegible handwriting there. I really love collage because of the layers, because of the texture, because of the symbolism involved, and mostly because I cannot draw or paint, and so it's all I got as far as an artist. So I've layered on some rough edges and some asymmetry here. Most of my pieces will involve this. The other reason I wanted to start with this art is because I'm going to then put up the art that's in the book and read my notes that are in the book. And so that way you will have seen how I assemble a collage, and you can sort of look into the art as I'm reading. The next layer, typically, well, this is 3 additional layers, some symbolism there, sort of getting at the fear and the death and sort of the creepy crawly of the insects. Adding another insect and a layer that I could then write on, and then finally the owl and the notes there. So you get an idea of how I put it together. And it's similar to traditional collage in that there's lots of cutting things out and layering them on. So now I'm going to start with the book and just put up different pages and read from them. I think I may comment a couple of times, or Susan may chime in and ask some questions or talk about things, but for the most part, I'll read the pages for you. Precious time. He has helped families understand by telling them they were into precious time, meaning death is likely, if not imminent. Precious time is when you say what you need to say and you don't say what you will later regret. Now it is us. We are into precious time. He is going to die of this disease, and I will go on and have to live with how I handled our precious time.
Can I do one thing?
Of course.
I forgot to show the book, and the cover of the book is beautiful. I mean, it takes parts from different pages, and the cover is just gorgeous, but I just want you to see the beautiful book too. Okay.
He helps patients understand the personalization of end-of-life choices by telling them about his own parents. My dad wanted only to be kept comfortable. My mother wanted every last life-extending measure. We honored both their wishes because the right choice for a person is their own. I'll just comment on this page. Insiders, family members of mine and Bob, who might be on this, know that this is not his parents. This is actually my grandparents, but what's really, it just was a better picture to try to go with that note. And, but what's hilarious about it is that people will look at it and say, oh my gosh, Bob looked just like his dad.
You know, I thought that as I looked at that, I thought, well, I can really see Bob.
Yeah, no, not so much. He wants to be cremated. He wants me to scatter his ashes over my brother's grave, as I did with my mother's ashes. Bob and I had a beautiful visit to David's grave a couple of years ago. Going back to scatter his ashes will be difficult, but knowing I am doing exactly what he wants will be comforting. I love that we have had the courage to discuss what he wants. My mother and I had that, and it made all the difference for me as a survivor. We are going through two different processes. He is dying, I am surviving. And I'm going to tell you a little bit about this page because I created it very early on after Bob's diagnosis. He had probably been diagnosed for about 2 weeks, maybe 3. And it was a Saturday morning, and we had made these plans to drive up to Crystal Bridges Museum in Northwest Arkansas. He'd been working. That's all that Bob wanted to do, was work. That was the most important thing to him. He'd been working, and I, of course, it was Saturday morning, and I was ready, to make some memories and get going. And he got really cross with me, and he said, "Jennifer, I am going to get you some literature about cancer fatigue." To which I promptly said, "I am not one of your bleeping palliative care fellows." And that sent us into a bit of a rage and a argument, what I will describe as probably the last silly argument that we had. And as I went to sort of, how you do, you go to your separate corners. And as I did that, I was so upset with myself because, of course, we're into the precious time thing. And here I was, already we had this big argument over something silly. And this was a real epiphany for me, was that the issue was, while we were doing this big thing together, we came to two different ends. He would die and I would survive. And it was going to be really important to manage my own survivorship. And so that was kind of a big one. We never had another silly argument. We had some arguments, but they were substantial, meaningful ones. As a physician at a world-renowned treatment center, he cares for patients and families from all over the world. Sometimes patients are too sick to make the trip home and have to die in our time. That always breaks his heart. He is glad to be a part of a center of excellence, but several times a year, he comes home from work saddened. "I just can't get this patient home to die," he says. He understands the desire to travel for the best care, but he is always troubled when people push it a little too long or have a complication and have to be away from their community when they die. And I'm just going to take a couple seconds on this one too, because this speaks to that issue when people get a diagnosis and they have this idea that they'll go to MD Anderson or Mexico or someplace, and they say they sort of shrug and say, well, what do I have to lose? And the answer is, you have to lose dying in your own community. You have to lose possibly the comfort of community for your loved ones that you are leaving behind. I'm not suggesting that we shouldn't go for the best care wherever it is, but that's always a question, not a statement. And I think a lot of people make it more of a statement than a question.
I think it's yes. Can comment on that too. Just like the picture of the non-Bob parents, the explanation on that was that she wanted everything done and he wanted comfort.
Yes.
And at the same time, I think some people can make for them a good decision that they want to go away. They want to go to where maybe there's not that much of their community, but but they want to have felt that they have done everything. So I think even within that, it's so individual. I mean,
You're exactly right.
that is finding out what they want and
Mhm.
helping as best you can.
Exactly. And that's part of that note about the non-parents, is that, you know, it was different. What Bob wanted was different than what I would have wanted, even though we were very close and we saw eye to eye on lots and lots of things. This was his death, not mine. And so those nuances needed to be honored as his.
Okay.
Anticipatory grief. Grieving before your loved one actually dies. It is real. It can be huge. In one study, 40% of widows reported anticipatory grief as worse than the grief after the death. I am suffering from anticipatory grief. The key is honoring my anticipatory grief while not allowing it to spoil the time we have left together. We had the foresight to transfer the cars and other property to my name. When the notary public made a comment about why we were doing it, we told her Bob was dying. She squirmed uncomfortably. I said, "We're at peace with it," something I had heard Bob say to others. For the most part, it's true. At the end of life, people die. I wish more people would accept that openly. We are not at war with it. We are at peace with the fact that at the end of life comes death. We are facing the tasks of getting things in order so that when the time comes, I will have only to love him, to mourn his death, and to miss him.
Can you talk a minute about the sign here?
Yeah, absolutely. You know, I just kept thinking about that.
It's so wonderful.
I kept
I
thinking
really
about,
like that piece. Yeah.
yeah, being at peace, and all of a sudden just the idea of putting these two symbols together. You know, it's a pretty simple design, and it's certainly not having all the layers that some of my other work has, but it has, you know, really spoken to a lot of folks. And it's probably the one that I get the most comments on, and I, you know, have little stickers and things like that. So yeah, even the youngsters dig this one.
I like it. I think it's really good.
Thank you. I will not miss the sleepless nights filled with his relentless moaning, wheezing, and suffering. I will not miss trying yet failing to comfort him. I will not miss wrapping his swollen legs. I will not miss giving him injections. I will not miss changing the sheets in the middle of the night because of his night sweats. I will miss loving someone so much that I do all of these things.
That's my favorite out of the whole book.
Is it?
It is, because it, you know, it speaks to the hardness of being a caregiver, but the love you have that makes it okay to do that, makes it fulfilling to you and to him. So
Yeah.
That's my favorite. Yeah.
Yeah. It is. That captures a lot of what you feel as a caregiver, and that, you know, that as exhausting as all of that is, you know, when it isn't around to do anymore, it means you've lost him. So as he sleeps, getting closer and closer to death, I arranged this tableau to introduce my loved ones who have gone on before to my beloved, who will join them very soon. He died peacefully with his hand in mine at 1 this morning, is what my text to family and friends read. Death may be peaceful for the patient, but it is not for the loved one in the room. During those last hours, they don't really look like themselves. They don't smell great, and they can be loud. Mucus builds up in the airway, and breathing is a loud rattle. Such was the case with Bob. I knew we were at the very end. I knew he wanted me and me alone with him. With each and every loud breath he took, I found myself holding mine, waiting to see if he would take another. I finally decided to settle in for another night in the chair beside his bed. I put my earbuds in and turned up Mary Gautier's Mercy Now, an album he had introduced me to many years prior. I could feel each word and note as I could feel his hand around mine. I saw the clock strike midnight, and then I must have fallen asleep, which is in itself a miracle. Next thing I knew, it was 1 a.m. A hospice nurse came in the room and said, "It's quiet in here." And sure enough, he had died while I was asleep. My hand was still in his, and his hand was still warm. It was the last gift we gave each other.
That's beautiful.
And in the end, all we really want is to know that we have loved well and been loved. And my gratitude, my grief, and my love. And this is the last page in the book and the last page I'll put up. And it is similar to the At Peace. It was an attempt I had written in an update email to my family, to our family and friends, you know, that hope and peace were both really great places to be, but that the passage between them was difficult. And so that's what this was an attempt to portray. And that's all I've prepared to read. So if we want to do questions, I can take down this.
That would be great. I'm going to ask some that I have thought about before this, but at the same time, our audience out there, please feel free. Probably the chat function is the best place, but you can do it in Q&A also, and I will monitor both of those. Jennifer, would you help our audience? Many in our audience may know the difference between palliative care and hospice, but some may not. Would you talk about that and what the differences are between the two?
Sure, absolutely. We'll start with the similarities. They are both interdisciplinary teams, including a physician, an advanced practice nurse or PA, physician assistant, a chaplain, and a social worker, sometimes a clinical pharmacist. All of these people have lots of extra training in palliative care and hospice specifically. So it's not just a social worker, it's a palliative care social worker.
Right.
The difference, and again, I'm not a medical professional, so I'm gonna just tell you from my perspective as the family caregiver and the patient and the so forth. The difference really to me comes between wanting to live fully with a life-limiting condition, palliative care, and then dying, right? So both require, when someone in your family gets diagnosed with or has an accident that results in a life-limiting condition or disability, it is a big deal. It is a big, unwelcome addition to the family. It affects all sorts of aspects of your life. And palliative care recognizes that, and palliative care is able to deal with some of the symptoms, some of the side effects that come from drug interactions, some of the psychosocial issues, spiritual issues, is recognizing kind of the impact of this huge thing on your life, and is able to recognize the caregiver, the family, and the situation that this has put them in. And typically absolutely, there's a big movement to get palliative care involved at the point of diagnosis with cancer. Which
or other illnesses. I mean,
or other illnesses, absolutely.
Yeah,
I think one of the one of the rough sides that palliative care sees right now is some specialists in other specialties who don't see the role of palliative care. And I've just recently had a friend who asked her cancer doctor for a palliative care referral, and the cancer doctor said, you know, why do you need that? And so that's, I think, the place that we run into some problems. But in general, palliative care helps you live fully with your condition. Bob had patients that, you know, that are still living. One of my good friends was a patient of Bob. She's you know, it doesn't mean you're dying. Typically, hospice means that you're not having any more curative or life-extending treatments, and you're wanting comfort before you die. And palliative care recognizes that at the end of life comes death. And so it is prepared to have some of those conversations too.
From the point of view as a hospice physician, both palliative care and hospice, they're both palliative care, but hospice, technically from a Medicare point of view, comes at a time, is appropriate to begin when, in the physician's best estimation, life expectancy is 6 months or less.
Yeah.
Now, not very many people are in hospice for 6 months, but there are people who are in hospice and then get better. So they go out of hospice, and that happens too.
Yes.
But for hospice, it is when the goals of care have changed and they are no longer curative, but palliative. They are, and I would say that it's still living your life as you best can.
Yes.
You know, as symptom-free as possible, as meeting your own goals. I mean, there are things like, you know, a wedding coming up, or
yes.
grandchildren to be born. And sometimes even a little bit more aggressive treatment is felt to be appropriate to get you to your goal, you know, to get you to those special times. Sometimes that happens and sometimes it can't, but they flow into each other. And it's a wonderful way to relate to people. So many, even earlier today, someone said, oh, it must be so horrible to be a hospice doctor. It must be so difficult. And it's not. It's not that you're not dealing with people who are sad, but you can help them. And one of the things in the book is that the patient will be okay. It's the family. And Bob knew that well, even.
Yeah.
You know,
yeah, he used to say that a lot. The patient's going to be fine. It's the family you worry about. And I think that's what the precious time is about, is the precious time is regret prevention. The precious time is this person's going to die. So say what you need to say, and don't say something that later you're going to go, oh, why did I get into that when we only had a limited amount of time left? Yeah. So I think we have a couple of questions too.
We do. One was a question from Karen Fee, and she says, do either of us, the panelists, have an informed opinion about or experience with the use of medical marijuana when a patient has a terminal diagnosis? And I will let you answer that first, and then I will say.
I do not have any experience with that.
And I don't have any direct experience prescribing it, because I really did not in the time when medical marijuana was legal in the state of Arkansas. But it is now. But I don't have direct experience, saying to someone, this is something I would encourage you to do. But I certainly have experience, anecdotal experience, friends, people I know who have used marijuana to help with nausea, to help with appetite, to help with a number of aspects, not just with cancer, but, with other illnesses. So I think more and more we learn about that. Physicians, at least now, are being taught about it. It was very difficult for a while, even as it began to be legal in the United States, in our area particularly. We had no training. We had no idea what amount was a good amount. Do you,
Right.
but now many of the training programs are teaching nurses and physicians about use of marijuana.
But it still has a bit of a stigma. I know. Anyway, I would say, Bob, even though medical marijuana was not a thing in Arkansas back when he was alive, he was, of course, offered it in an unofficial way, and just was never particularly interested in partaking. But I do think it brings a lot of comfort. So I think it's like a lot of those other symptom management mechanisms. Try it and see if it works for you. I think we have a few other questions.
We have a lot right now. From Maureen, this is a very moving story. What did you do for self-care during this difficult time so you could continue to care for Bob?
Yeah, the journal was really what I did for self-care. I made a lot of art, and I kept a journal, and so that's mainly what I did.
Okay. Jan Bowen wrote, my husband died over 10 years ago. At that time, I didn't know about the concept of anticipatory grief. So when I never had what I called the big cry, I always felt guilty about that. The guilt was eased when I understood that the anticipatory grief concept. And that's good. I mean, I'm glad you got that knowledge and that release, because it is very hard. Well, one of the things that I wanted to talk about was the time arc of deaths. I have had 2 family deaths where we were called and both people had been in an automobile accident and died instantly. That, that is so immediate. Jennifer, your brother also had an accident and died shortly thereafter. Sometimes people can be ill for a short period of time. Sometimes it's like with Bob, where it may be months, and probably more months than you thought that there were going to be. And sometimes it's a very slow process with degenerative illnesses. And each one of those has a different way that grief may be experienced. If you've seen someone's grief, you've seen one person's grief.
Right.
Everybody experiences it in a different way.
Right.
Do you have thoughts about that arc? Because you have experienced it in different times.
Yes, I do. I think that, for example, when Bob used to tell patients about precious time, he was telling patients that were fairly close to death. I think I only knew about it 22 months ahead of time because I was married to Bob. And so, yes, that can be a very difficult arc when it's one of the less steep ones. It's about slowing the pace down and going deeper rather than faster and higher kind of thing. And that's just a big adjustment that I think you have to make when a diagnosis like a longer term degenerative disease is in play. So yeah, and then you have to give yourself a break when it's not all perfect and precious time, you know, when it has its moments. But all of them are, I think you have to be careful of comparative suffering only to the degree that you impart it on others or it makes you feel bad about yourself. So sometimes it's helpful to say, well, at least it wasn't this, right? That makes me feel better. If that makes me feel better, then that's the only kind of comparative suffering I think is okay. Saying to somebody else, well, at least it wasn't this is not particularly productive.
But people judge others on their grief, how that other person experiences grief, you know.
Yeah, there really is many
been 2
different
months
ways.
now. You need to get out. You need to do
Yes.
this. You know,
Oh,
pull
I
yourself
know.
up by your bootstraps, you know,
Yes.
and do not let yourself be judged by others. If your sense of grief is keeping you from living your life, then look at whether help may be needed. You know, if you have been in hospice, they follow for more than a year, for 13 months at least, after a death to help you in that grief process. Experience it as you experience it. I will ask another question.
We actually have a couple that are somewhat related.
Okay.
Because Erin has asked about people getting the book prior to death. And then Valerie has asked about speaking to the issue of preparations that are on page 63. And so those are kind of similar. I've been at times, there was once or twice when I was, it bothered me a little that someone said after receiving the book or reading the book, wow, I wish I'd had this before my husband died or before my mother died. And, you know, of course I was like, well, yeah, I wish you'd had it. But the truth is, I have also now had people who received the book shortly after their spouse or parent died, many years after, and it has helped them. It has helped them to identify with some of the more brutally honest moments that I share in the book that perhaps weren't so pretty, and feel comforted by that. But by the same token, there is, I mean, the majority of this book was created as my own journal and list and lessons learned and struggles had before Bob died. And so page 63 does have a pretty long list of all kinds of things that we did to prepare for his death, which quite frankly made it that much easier than for me to focus on missing him and loving him instead of having all these administrative details that come up and overwhelm you and take up all your emotional energy. So, so if possible, yeah, this is a good book for somebody before they die, before their loved one dies.
Yeah. Marcia Daniels asked whether you sell your collages at a gallery here. Collages, and they're beautiful.
Well, thank you very much. Well, so we launched this book on February 25th at Boswell Moreau Fine Art, and these collages that are from the book that are hanging behind me were up on the wall. They were not for sale that night because I really wanted us to focus on the book. The irony, however, that, and we had like 200 people at that party, which was awesome. But the irony that we ate funeral food and we drank obituary cocktails at what did turn out to be the last hurrah is not lost on me. That, you know, I ran into somebody yesterday who said that was the last thing I ever went to. So, so right now the collages aren't for sale. These are actually giclée prints, but I might do that. I might.
Yeah,
Yeah.
you might really think about that.
Yeah.
Lori Cicero, excuse me, Lori, asks whether we have advice how to deal with the death now in the times of COVID-19, when being together is limited or impossible. And that is a particularly difficult situation, because talk about not being with your community. You know, people are isolated. They don't even see the full faces of the medical staff coming in. I mean, there are lots of wonderful stories of seeing through windows, or, you know, at nursing homes, you can't go in where people are sick. You can't have family visitors. So it's particularly hard. And even the grief afterwards, I mean, the closure that may come through a funeral service is just not the same in this time. And we should all do whatever we can to take care of this pandemic, and as much as it will ever happen, let our lives go back to normal. I don't know any other.
I actually posted a short thing about this on Medium. I have a little page on medium.com about not being able to be with someone who dies because of COVID. And I mean, not being able to be with them because of COVID, whether or not they die of COVID is immaterial to this particular article. I think that it's important to keep in mind that, and you know this better than I do, Susan, a lot of people choose to die alone. They don't want to be surrounded by their loved ones. And I know this was the case with my grandfather. I knew how he would go. He would go by himself, and he did. And so one thing to keep in mind is, you know, let's be realistic about who this person is and whether this is even something, are we upset for ourselves more than the person? And then I think there are things we do to just be closer to that person. We listen to the music that they love, we cook the foods that they love, and we just get in the space that that pulls us closer to them. I really wish somebody like even Alexander or someone from the near-death experience community would write on this topic, because everything you read about near-death experience, the person who is dying can be with their loved ones no matter what the distance, physical distance is, as they're dying. And if we got some reassurance on that, I think it would feel a lot better to get to that meditative mode and feel a closeness with them that is not dependent on being physically next to them. So that's just some thoughts I have on it. I do have some suggestions for being supportive to friends. Anne asks about that. And that is really as simple as checking in frequently without expectation of a response. There's a page in the book that talks about how our best friends were the ones who would check in, but but be okay with us not writing back.
By text, not
Mostly by
necessarily.
text, yes, because the phone call is a, you know, I have to answer it. I feel a certain obligation, and you just don't sometimes have the time or the energy or the capacity to do that. So when I know a friend is going through something rough, I like to send a text, sometimes just the little bouquet of flowers or the little red heart or something that just says, I am thinking of you. And if I'm getting it started and I'm not sure that they know that they're not expected to write back, I say, I am sending you good vibes today. You have no need to respond, you know, and kind of set that in motion. And as far as, you know, being with them after the person dies, I would tell you that it's, first of all, most of us want to talk about our loved one who has died. So when we say things like, you know, today was our anniversary, there is no need to go, oh, I'm so sorry. You know, that is something I'm looking to celebrate. I'm looking for a big smile on your face on that. And so that, on the other hand, if someone's really, there's trauma and someone's not ready to talk about it, saying something like, I want to listen if you want to talk, is a really great way to put it, so that people feel like there's a place for them to talk. And then, you know, a lot of it is just making space and being quiet and being there for the person.
And you talked about similarly, as Bob was dying, that though you wanted to get the answers to exactly what he wanted in this process, it wasn't sitting down and going through a checklist. It was, as things sort of came up, then you would discuss them, or you would, we're doing the same thing. I am here to listen to you. And I really thought that was good advice, that everything doesn't have to be decided in one conversation, but remember what they are, you know, and then, you know, make notes as you can, so that, for me at my age, I need to write things down so that I know exactly what the music is, or exactly what the, you know, what he wants in the obituary, you know.
Right. Well, and it's not even just age in that case, because you just have so much else on your mind that you cannot be expected. I mean, that was the thing when I listed on page 63 the two things we didn't do that I wished we had. And one of them, which I just beat myself up for, was the passwords. I thought I knew all of his password formulas. And then after he died, I didn't remember them all. So anyway.
Kevin has a question. Kevin said, I think your book has come as a gift to many people. Do you find yourself re-experiencing the time it describes when you share it publicly like this? I guess what I'm curious about is whether reading from it brings you comfort or grief, or both simultaneously.
Probably both, a little bit of both. I'm not sure simultaneously, but there are times, mostly it brings me comfort because I know it is helping others. And I mean, really, that's the only, that is the only payment for doing this, is when I get an email or a note saying your book helped. That's the only thing that keeps me going on continuing to share it, because yeah, it is a little bit of a re-experience. Sometimes more than others.
Spencer has a question. He asked, how has this prepared you for your own death, or has it given you a different approach to your own life? That's a great question.
That is, well, that's Spencer. He asks great questions. You know, I have, well, it's funny. There's a page in the book that I read actually about the tableau I prepared when Bob was getting really close to death. And I put out the photos of my family that had already died, and that and then some of Bob's things, his Grey's Anatomy and his Dylan Lyrics book, and a picture of the two of us, because I wanted them to, you know, I wanted to make a connection. Bob, interestingly, is, even though he was 69 when he died, he had never lost anyone except his parents, and they both lived into their 90s. So he said to me at one point, so you think I'll see my parents? And this was a real surprise to me, because it wasn't, you know, I am in joyful anticipation of when I am reunited with the people I love who have died. And he wasn't expressing that. And I mean, not that he wasn't excited, I'm sure, about seeing his parents, but there was nobody else. And I remember saying, kind of just being stunned by that. And maybe a day or so later, I realized, I said to him, my mother's name is Victoria and my grandmother's name is Babe, and they are looking forward to seeing you. And so when you ask about preparing for my own death, I mostly I just want to live a really healthy life, and then at some point, and not too old, go lie down to go to sleep one night and not wake up. And yes, I have made arrangements for what happens when that goes down. Mostly I just don't want to get sick, like so many of us probably will. But yes, it definitely makes you think a lot about your own life and death. But what's interesting is, you know, I felt really, especially right after Bob died, I felt, there's a page in the book that says, I'm not suicidal, but I would welcome death. There's a point at which you're just so sad, and that you're like, yeah, okay, if you took me now, you know, like if I got mugged on the street at gunpoint, I'd be like, look, buddy, don't miss. Hit the heart, don't miss, you know? But then something like this happens, and the book starts to get out and to be helpful to people, and it gives you this sort of, you know, reason. And so that's kind of where I am right now.
I will answer that question too. When I read Jennifer's book, this beautiful book, the night that I read it, after I cried, I mean, I cried in many places in the book. I wrote to Jennifer. It was when we were just starting to connect with each other. And I told her, this is how I want the end of my life to be. And it really is. And so I got my husband to read it too. And we talked about it a little bit. But there'll be time, you know, or there won't be time, you know, the bus may hit us tomorrow.
Right.
I don't know, but I think it's a very wise, very honest book. I really liked it.
Thank you.
Okay. We have a few, I think 6 or 7 more minutes. Karen asked you, what are you working on now? What art and perspective are you giving to the world that we can look forward to?
Oh, I am, you know, honestly, I'm working on figuring out how to get this book out to more people who need it. I do some art whatever, I don't do it every day, but I do it regularly. Some of it, since the pandemic, has been is not digital, tactile sort of stuff, because for whatever reason, I think I need that. And then some digital stuff, but got something coming up with the metastatic breast cancer folks, which is important to me because those are patients who will die of their disease. So not, mostly I'm just trying to figure out how to get this book out to more people who need it. That's what I'm working on. It's not a lot to look forward to, Karen. Karen's my cousin, so
Good.
yeah.
That's good. I will say we have been asked to go on an extra 30 minutes. I don't know whether, so Joe needs to answer that. That's a possibility. I have
We've been asked I'm sorry, we've been asked to go on an additional 30 minutes?
just talking.
Okay.
Question.
Yeah.
But I don't know whether that's a possibility. It may not be. You know,
Okay.
they may. I know.
Well, I'm good with it. Whatever y'all want to do and can do, I'm fine with it.
I have a question, or at least something I would like you to talk about. Bob participated in a program that's called the Gathering Hope Life Review. And I'll tout Arkansas Hospice, which is the hospice for which I worked, and Bob was very closely associated with too. And they have started a wonderful program where trained volunteers, and for Bob, that was another one of the hospice positions, talk with them and let them just talk about their life, whatever they want to talk about. They may have one long interview, or they may have a series of interviews, but the volunteer then will write up that discussion, the life review, and they present it to the family. And it's a pretty wonderful program.
Yeah, it's incredibly wonderful.
But and you have different things from his life review, you know, different sections throughout the book. But the first one that was so amazingly honest to me was that Bob talked about the time he was diagnosed and the fear that he had. And
yeah.
I asked you whether you could talk about that, and you said you thought you could now.
Yeah.
So will you talk with us about that?
Yes. No, he initially, when we got the diagnosis, he was very fearful. What happened was he found a lump in his neck and palpated it and had a couple friends at work take a look at it and decided it was nothing to worry about. And wonderful doctor, ENT, followed it for a little while and then just said, I'm not comfortable just, palpating this. And he was having some abdominal symptoms. And so when he went to have the pre-op for the needle biopsy, he asked, at the ENT, he asked them to do a CT of his abdomen, which is not typically done at an otolaryngologist. But anyway, and there were some lesions showed up in his abdomen, and initially everybody thought it was lymphoma, which is serious, but is also, people can live for years with lymphoma. It's manageable in many cases. So he was, so we went into that needle biopsy thinking that that's the answer that we were going to get. And the doctor called that night and said, it's not lymphoma, and it is something really, really bad. And we're not sure exactly what it is. And we're going to send it out. And that was utterly frightening. And I think that Bob was really stunned at how afraid he was. Bob was an old surgeon. I mean, old surgeons don't get afraid. They're not afraid of much, they just go in and sew it up and fix it up and be done with it. And I think I know I was devastated when I got the news, but I think Bob was really stunned at just how afraid he was. And he did just kind of try to go back to work and had to sort of stop in his tracks. And then And then talked to another old friend, John Gosho, another surgeon, who said, you know, validated the fear and said, of course you're afraid. But as I think happens with these things, you know, another concept in the book is sort of hoping for the best and preparing for the worst, and you adjust to what's happening once you get over that initial shock and fear, or at least we did. Bob did. He very much, you know, sort of started to get comfortable with the treatments and okay, we'll just take this the one day at a time kind of thing. So
thank you for talking about that, because the you know, sometimes people think, well, a physician's not going to be afraid, you know,
right.
they're going to understand what's going on, but it's hard no matter what.
Yes.
The answer is we're going to end our session now as scheduled.
Yep.
There are more sessions to go.
Yes.
I am willing to give my email address, and Jen, you may or may not also.
Yes, no, I'm absolutely, and I have a website, hospicedoctorswidow.com, and there's you can get me through there, and
Yeah.
I'm absolutely, I would love to hear from anyone and everyone.
And my email is tuckerfly, TUCKERFLY, number 2 at AOL.com. And contact us if you would like to. This has really been a lovely session. Thank you, Jennifer. Thank you for great questions. Again, this is the book, The Hospice Doctor's Widow. It can be purchased through the Six Bridges Book Festival. There are links to doing that, and also at our wonderful Wordsworth Books. And thank you for coming. And it's been a lovely afternoon. Thanks. Bye-bye.
Bye.